Yeah, my name is Claudia, and I am a physician. I'm actually a physician scientist involved in clinical scientific medicine for 35 years. And I spent time in a laboratory that is a molecular biology laboratory. Then I started to get sick, and I got sicker and sicker. Because of my background, I just plain wasn't going to just get sicker and sicker and sicker without figuring out why I was getting sick. And nobody could figure it out. I had a series of symptoms. I was able to research them. But putting together the diagnosis or getting people actually to believe me, which interestingly was very hard, became rougher and rougher. Look at things. I saw how Dr. Harris dealt with my son. I knew the challenges my son had. I knew the safety issues that came with ketamine, and I felt they were being taken care, and then the psychological issues. I felt they were being taken care of in a way that I felt confident with. Watching as an anesthesiologist with my son with this therapy, he went through the ingredients that came from this infusion that was designed by this European physician. And together, because I'm a kidney doctor and he's an anesthesiologist, we sort of tried to dissect what each component meant. Now for me, I wanted to get better, but I also because I'd been sick, I hadn't had the opportunity to talk medicine and so I had fun just finally talking with someone who could use my language, and I think both of us enjoyed this. We could challenge each other, and we went deeper and deeper and deeper. And we had a few occasions where he came up with something that I should have known as a kidney doctor. And, he knows what those are, and we both still probably laugh about them. As the treatment started, and after, 3 or 4 weeks, my body started evolving. And based on the change in my body, our clinical findings that would only be picked up by a good clinician, changes of the skin, we realized that together, but definitely led by Dr. Harris, that I still had ongoing infection. And so Dr. Harris added to the infusions. It's a high level, but it's a common antibiotic. The relationship between Dr. Harris and his patients, I was able to observe firsthand as I was in the waiting room and seeing both my son and other patients come in. And these are very difficult or challenging situations, and it needs to be dealt with a knowledge base, but also with empathy and establishing a connection. And I've seen a lot of doctors. I've taught a lot of doctors, and Dr. Harris has an ability to connect with his patients or clients in a way that we try to teach to our medical students and can't always get. And then he mixes this with quite a deep knowledge base that allows him to figure out what an individual patient has. And it's not just cookie cutter, it's really individualized. most important things to somebody like me who's made thinking a core of my being. That was taken away from me, and it's coming back. I am a believer in micronutrient infusions. The field of nephrology is actually a field of metabolism, so I know these things are at least the pharmacology of things in a very deep way. And so I understand why a given constituent is in something, but it has to be individualized. It has to be. And the fact that he has the knowledge base to do that, I think, is important. And one can probably make get some benefit from standardized, but you're sure going to get a whole lot more with customized.
When I first met Claudia, it was actually as an aside. She accompanied one of her family members who was seeking treatment with us for depression. And I could tell that she was suffering, but I really didn't know the backstory. When she approached me one day, I was absolutely fascinated with the complexity of her history, both clinically and emotionally, as she had struggled to recover from a very rare and very debilitating situation. Thankfully, she had ventured actually outside of the United States to seek care when she first became aware that possibly dentistry and the lymphatic drainage of the root canal that may have become sort of chronically anaerobically infected, that they may have been the cause. And so she went actually to Switzerland and then Costa Rica to seek relief. And when she presented me with this infusion protocol that included a lot of ingredients, some of which make sense, some of which I've used myself, but not necessarily all together. And so after a lot of research and exploration in terms of sourcing, we were actually able to come up with this unique protocol and source it from areas all over the world, including Ukraine and Colombia. And I really enjoyed the intellectual discussions that me and Claudia had engaged in during her treatments and between them, as we sought to both better understand what her body was going through, to the point that we actually came to believe that while the resorption of, possibly impure dental materials may have started this cycle of negative health consequences, it was actually the infection that probably had traveled through her lymphatic system and had deposited itself peripherally all throughout her body, much like an infective endocarditis would present. And in fact, that had actually been a diagnosis that she explored, but it never was found. So by adding an antibiotic regimen to the protocol that she had brought to me, we began to see really amazing results in terms of her decreasing what she would describe as the feeling of toxicity. Swelling seemed to resorb from her extremities, and she was actually releasing a lot of these foreign bodies and sort of infectious foci through her skin. It was the craziest thing to watch. In addition, the skin itself softened, and the fibrotic connectivity seemed to decrease such that we were actually able to better insert IVs based on the lack of tortuousness of the veins. They actually straightened out when they weren't adhered to the connective tissue around it. It was really a remarkable transformation that she's still undergoing, but it's been an honor to be a part of her journey.